Safe and early mobilisation is presented by Ashley Azzopardi, a physiotherapist, and Claire Gardner, an occupational therapist at the Sutherland Hospital, South East Sydney Local Health District. They will share practical strategies to prevent deconditioning for patients in hospital.
Does this sound familiar? Bob, a 72-year-old man, was admitted to the ward on Friday evening. He was advised by nursing staff to remain in bed awaiting a physiotherapy review on Monday. On Monday, the physiotherapist reviewed the patient and he was able to mobilise independently, but reported feeling weaker on his legs. This hospital deconditioning could have been prevented if the patient was given the opportunity to demonstrate his ability to walk over the weekend. Does this happen on your ward? Many older people with long-term health conditions are still suffering the consequences of inactivity and loss of social contact over the many months during the COVID-19 pandemic. This means older people are unable to walk as far and feel less steady on their feet. We know that safe and early mobilisation reduces the risk of functional decline, muscle wasting, increased hospital length of stay, further medical issues such as DVT, pneumonia, delirium, increased confusion and infection, pressure injuries, incontinence and constipation. Safe and early mobilisation is an element of the comprehensive care minimising harm model. Safe and early mobilisation involves getting patients out of bed where possible, to sit in a chair, march on the spot, walk to the end of the bed or toilet and have a mobility plan in place, identifying an area that is safe for the patient to walk with their family or staff, and having mobility equipment within easy reach.
We spoke to staff and the main barriers to not mobilising patients without prior physiotherapy assessment were unknown mobility, poor mobility, patient's cognition, nurse and staff confidence, fear of patient falling. The Clinical Excellence Commission has developed a step-by-step process to encourage nursing staff to safely mobilise patients, taking into consideration medical and environmental factors, as it may not always be necessary for nursing staff to wait for a physiotherapy assessment. This guide is displayed outside patients' rooms. We are encouraging nursing staff to use their clinical reasoning to determine if a patient is medically stable and appropriate to get up out of bed. The guide helps them to consider the following. Can the patient follow instructions? Can they move around in bed? Can they sit safely on the edge of the bed? Can they stand upright? Can they march on the spot? If yes to all, give it a go. If the patient is unable to participate in any of the steps, consider if the patient requires pain relief. If unable to walk, consider repositioning or using mechanical lifters to transfer, and refer to a physiotherapist and occupational therapist if required. The elements required to give it a go on your ward. Provide education on Give It a Go principles. Display the CEC Give It a Go guide. Make sure mobility aids, chairs, toileting and showering equipment is available, maintained and adjusted. Communicate with patients, families and carers to determine their baseline mobility status. Ensure mobility status is communicated with staff at safety huddles, bedside clinical handover and MDT meetings. Document in EMR and maintain up-to-date mobility status on patient care boards. There are resources available on the Clinical Excellence Commission website to enable safe and early mobilisation. Getting patients out of bed, dressed and moving enables patients to go home sooner. We encourage you to give it a go.